I'll start first with Dr. Connell. You know, we're blessed in Indiana to have a place like Ivy Tech, being the biggest manufacturer per capita in the country. I think next to Wisconsin, we're always nip and tuck there, but we have got a broad need for better skills, better training. You train the largest number of nursing students of any institution in the country. That's impressive. I didn't know that until today. You built partnerships throughout the states to raise awareness about jobs in high demand and develop training programs, clinical experiences to meet that demand. What best practices would you want to highlight so that other states can know what's worked in Indiana?
Thank you for the question, Senator Braun. A lot of our work is being able to partner with our stakeholders around the state. As a singly accredited college system, we do have the luxury of working with institutions like Indiana Hospital Association, Indiana Healthcare Association, and our employer partners to understand the need in the specific service regions that we're working through where our campuses are located. So again, being really thoughtful and mindful and intentional around making our decisions to meet those local needs has been very helpful in identifying where we need to think about programming, think about creating additional access opportunities, and then pairing those with the tools that students would need to be successful.
Last September, the Biden administration proposed staffing minimums for nursing homes. Today, we heard about other efforts to create national standards for long-term care workers for licensure, labor, protection, wages, and benefits. How have state and local controls contributed to the ability for you to train and educate more students? And is it necessary to have more federal involvement, or would that complicate things?
Thank you for that question. Again, I think working with our local stakeholders has been very beneficial and giving us an opportunity to understand the specific needs of the various service regions that we serve. What we'll see in Indianapolis is not what we'll see as a need in Terre Haute, and so being able to customize our approaches to meet those specific needs has been very helpful. I think generally we support the efforts to ensure that there's adequate supply of skilled long-term care workers to meet both community demand and enable high-quality education and skills training opportunities. But again, being able to work locally with our industry partners has been valuable.
One final question before I turn to Ms. Vogelman. And we have, through a bill introduced, Jobs Act, would allow students to use Pell Grants for high-quality, shorter-term job training programs. I'd like to get other methods here to where they'd have more flexibility. I'm guessing that expanding that would make your job easier. And how much of that have you realized from the federal government to this point, to where they give you more flexibility with funding here to apply towards your programs?
Thank you. We do support the bipartisan efforts to expand Pell eligibility and high-quality, short-skilled training. We think that would also help go a long way with healthcare and long-term care as well. We understand that working adults and students who currently enroll in short-term programs to upgrade their skills must pay out of pocket, and that's one of those access points and the pairing that with the tools required for success that we do believe could be a barrier for individuals and would support additional leniency there.
Thank you. Got a couple questions for Ms. Vogelman. You have shown us how opportunities for growth are crucial to the success of long-term care workforce because of your devotion, passion, desire to learn. Your employers have sponsored for you your LPN and your RN degrees. You want to elaborate on that a bit?
Thank you, Senator Braun. So yes, I have received full sponsors for my tuition, and along with covering my tuition, they've also helped with child care services while I was in education. I think, as you've mentioned, we are making great strides on bringing the workforce and the new talent within Indiana to the care force. I think the resources still needed are really going to be helping the existing staff, providing preceptorships, mentorships for the new staff, as well as that critical quality training right there in the beginning, and allowing them to advance within their careers and with the support of their employers as well.
I want to give a shout out to your employers and the fact that they oftentimes want the educational system just to automatically be there. I think there has to be an interaction between the two. And one final question. I was on our education committee for 1 year when I was in the State House. And I often thought that career and technical education, skills-based, just wasn't there in middle school through high school. How much is that important to where only about a third of all jobs out there need a 4-year degree? How much better can we do by talking about skills and training, apprenticeships, and everything that goes into probably the 2/3 of high school students that are going to go directly into the workforce? Do you think that's been given its due attention?
I definitely think that we could spend more attention trying to reach them at earlier in time so that they can really be introduced to the healthcare, because there are, as we spoke about, a lot of demands in healthcare that sometimes I feel even my students weren't prepared for once they actually get out into the field. So to introduce them earlier and then give them those stepping stones to really building their career is definitely important. And I'm actually very interested in some of the things that Dr. Connell was talking about with the high school at the Ivy Tech level. I know TLC management, we actually try to do a lot with junior achievement in Indiana and trying to reach them a little bit earlier. And we also try to work with dual credits within colleges, and we're actually starting our first apprenticeship program for those students with school schedules and working around them and allowing them to come into the care force.
Thank you. I yield back.